Hello, my name is Jonique,
And my name is Aisha Williams Polite.
and our topic that we'll be talking about today is burns.
Okay, so first I want to start off by saying the types of burns. There are several. You have first degree, second degree, and third degree. Some people refer to a fourth degree of burns, but for this course and its curriculum, we connected the third and fourth degree burns. So first degree burns, these are burns that only affect the outer layer of your skin. A perfect example of this is a sunburn. So the skin will be red and painful, but you will not have any blisters, and long-term damage is usually rare. Next, you have second degree burns. For this type of burn, the outer layer of your skin, as well as the dermis, is usually damaged, and your skin will be bright red, usually swollen, and it could possibly look shiny. You will definitely see blisters, and the burn will hurt to the touch. So if you have a superficial second degree burn, only part of the dermis will be damaged, so you probably won't have any scarring. But when it comes to deep partial thickness burns, those are more severe and it could possibly leave a scar. Lastly, you have third degree burns. These are sometimes referred to as full thickness burns. So this injury destroys two full layers of your skin, and instead of turning red, it could appear black, leathery, brown, possibly even yellow. These burns will not hurt because the damage to the skin is all the way through the nerve ending, so they're virtually painless.
All right, so next we'll talk about the emergency management of burns. So you would get into first aid, fluid resuscitation, and pain management. Now I'm going to elaborate on that. So for the emergency management, the first aid is utilized to stop the burning process and to cool the wound. Lowering the temperature of the burn surface can potentially be an effective painkiller, but this should only be done 3 hours post-burn injury. So for fluid resuscitation, IV fluid should be given with burns, and this is when the burns are 15% or more. Organ perfusion along with the perfusion of around the burn should be maintained to prevent thermal necrosis. Crystalloid solutions are preferred for hypovolemia and extracellular sodium deficiency. However, normal saline should be avoided because it can cause hyperchloremic metabolic acidosis. In the pain management area, drug administration is the most effective treatment, such as opioids, NSAIDs, anti-inflammatory drugs such as paracetamol and dipyrone, anticonvulsants for the neuropathic pain, antidepressants, ketamine during dressing changes, which can be very painful, along with benzodiazepines.
So we wanted to talk about some potential nursing diagnosis that could be presented with the patient. The first one is impaired skin integrity related to burn injury, as evidenced by disruption of epidermal and dermal tissues. When you have a burn patient, it is imperative that you salvage as much skin as possible because there will definitely be a presence of impaired skin integrity. Next, we had fluid volume deficit related to increased capillary permeability as evidenced by hypotension and decreased urinary output. I wanted to mention a last one, which is disturbed body image related to traumatic event as evidenced by social isolation. When a person has scarring from burns and burn injuries, it is very likely that they will have some sort of issue with body image because some scars can be very severe and you can cause contractures and just stuff that will just overall affect their self-esteem. I wanted to mention the social isolation because that will be something that will be evidenced. They might not want visitors to come visit them. They might not want to engage in the activities that they used to love prior to the injury. And so they would just be operating and isolating themselves.
So when we get into the complication of burn injuries, it's important to consider the depth differentiation, systemic issues, local issues, infection, and scarring. When we get into depth differentiation, certain burn injuries can first appear very minor, such as inhalation injuries. However, in actuality, they are more extensive in depth depending on the location, the tissue that is injured, and also the degree of severity. Scarring in deep burns can cause psychological discomfort in patients, along with immobility issues that can come with the contractures, such as the limited range of motion. Systemic issues such as fluid loss and skin breakdown can lead to systemic complications. These types of complications are directly related to the total body surface area that is affected. So risk factors of mortality with severe systemic complications are burns more than 40% of their TBSA. An age greater than 60, and when a concurrent stroke, inhalation, or major trauma along with hypoventilation and infection is involved. Local complications such as contractures, scarring, and eschars can come from burn injuries as well, which also disturbs their body image.
So when we discuss incidence and prevalence of burns, had a couple of statistics. So approximately 180,000 deaths happen yearly due to burns and burn injuries. Burn injuries receiving medical treatment annually total about 486,000. And the incidence of localized and peripheral neuropathies ranges from about 15 to 37%. So when you're discussing the neuropathies from burns, they're likely caused by the combinations of direct thermal injury, circulating neurotoxins, the changes in distribution of fluid and electrolytes, compression by bulky dressings, and stretching of the peripheral nerves with improper positioning for prolonged periods.
So getting into the nursing educations of burns, which is important so that we can care for these patients adequately as possible and to give them quality care. Assessing is very important. Assessing the ABCDs, pain, and the wound assessment thoroughly, along with the 6 C's of burn care. So thorough ABCD assessment followed by a focus assessments include a full head to toe assessment that should be conducted due to burns being very extensive and being an issue and an insult on the body. So clinical issues along with deterioration should be identified early as possible so that we can care for these patients appropriately and timely. With inhalation burns, airway and breathing should be monitored carefully because these patients can deteriorate up to 72 hours per post-burn injury. So it's important to initially assess them adequately. Pain assessments are critical due to the loss of the protective skin barrier. So we should make these patients as comfortable as possible, being that they've been burned and that the epidermis along with the dermis, their skin barriers are gone. So even though that these burns are going to be very painful, it's important to make them as comfortable as possible. Wound care assessment is critical initially prior to wound care, along with intervals that when you are seeing these patients. So this helps determine infection characteristics and the degree of healing, which will both determine other interventions that may be considered. When we move on to the 6 C's of burn care, these are clothing, cooling, cleaning, chemoprophylaxis, covering, and comforting. I thank you guys for watching our presentation, and I hope that we were able to give you as much information as possible so that when you encounter a burn patient, you're able to thoroughly assess them and anticipate their needs in regards to care.
Thank you.